I'm Rod Rohrich. Welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. Well, today we have a special treat. We have Dr. Chiddy from Instagram and TikTok with us, who's a real board-certified plastic surgeon from Utah. So, welcome. How are you doing, Jerry?
Good, Dr. Rohrich. How are you doing?
I'm
doing awesome.
Awesome. I'm awesome. Listen, we all enjoy his TikTok and Instagram. If you want to have fun and have a nice smile on your face, watch this amazing plastic surgeon. He has fun and he's a fantastically talented plastic surgeon. So let's talk about what are the market differentiators for you. Now, you're a plastic surgeon in Utah and you're near Salt Lake City, correct?
Yeah, we're just south of Salt Lake, about 20 minutes, kind of in the whole suburb of Salt Lake City in Draper. So honestly, in Salt Lake, this is like the Beverly Hills of Salt Lake City. It's just Draper area. Highly concentrated amount of plastic surgeons here.
Oh, really? Well, that's awesome. Yeah, that's awesome. So, I mean, how long have you been in practice?
So I started my own practice in 2020. Prior to that, I was with a facial plastic surgeon for about a year and a half. And then I got board certified, started my practice, Jerry Chiddy, MD, January of 2020, like 2 months before COVID. We had no idea that was going to happen. So the fact that I'm here today for one, is
it's a miracle.
Special, yeah.
Yeah, no, I know. I mean, COVID was a whole nother life experience. But you know what? A lot of good things came out of COVID. I started my podcast during COVID because, we were kind of bored for a while until, things took off like amazingly. So what are the three market differentiators you would say? I mean, obviously you're a native Utahian, so that's good. So you know the people. And so, and it's a beautiful, beautiful place, beautiful state. People are nice. I mean, it's almost like Texas, People are nice.
Yeah.
Except we are bigger in Texas, but
everything's bigger in Texas. We just have big mountains. That's about it.
Yeah. We don't have mountains. We don't have mountains. We don't have mountains and we don't have an ocean, but we do think big though in Texas. So anyway, so tell us what are the differentiators for you and what, you have an amazing private practice and you've really grown amazingly. So tell us what are the differentiators in your mind?
Yeah. I mean, so again, like I said, I'm in Draper, so there's a high concentration of plastic surgeons, and in Salt Lake City and Utah in general is one of the highest per capita for number of plastic surgeons in the country. It's high up there near Texas and California and DC and Miami or Florida. So for me, when I started my practice in 2020, I was like, how do I figure out how to differentiate myself? What is it about my practice that we can do? And I really tried to take the approach of, again, in the beginning, using social media to really educate and get my information out there, get my face out there. I didn't have a budget for billboards or ads or things like that. So I had time. I know a lot of people during COVID had time, but I tried to utilize that time to really build my presence online. And so I think one of the big differentiators when I came here and kind of disrupted this market was my social media use. And I've seen since then a lot of, local surgeons and colleagues up their game and do more. And it's great to see them grow using that platform. Secondly, along these same lines, I think as I grew my practice and really got busy pretty quickly, people were waiting for surgery for a little bit. And so I was like, how do we optimize patients really to have that full experience? My wife and I are huge Disneyland fans. We were in Southern California for 7 years for training. So we're like, how do we have that like Disney experience where people come in and they leave like, wow, that was fantastic. I want to tell my friends about it. And so really, we try to conceptualize from even before meeting patients, when we meet them, and then after, and the whole journey around surgery, the whole experience is being very unique and addressing everything we could from, post-op care, lymphatic massage, compression, every single detail we could think of to really make that a positive experience. I think we've been able to achieve that. And then lastly, honestly, our facility here, and Dr. Rohrich, you need to come out and visit us. We'd love to have you anytime. We'd love to learn from you and come check this out. But we have a gorgeous facility. It's a 75,000 square foot facility. We own this building. We occupy half of it, about 40,000 square feet, our clinic, our spa, and then we have a 5 OR ASC below. So it's a very unique setting because everything is here, and it's just, again, it's all about the experience. And so I think that really is what helps us differentiate ourselves in the market.
Yep. No, I agree. I mean, wow, that's amazing. I mean, I've seen pictures of it. No, we have, I have 11 partners, and I don't think we have, we almost have 40,000 square feet, but I have 11 partners at 4 ORs. Now, that's amazing. And I agree. Patients, they want that experience from the time they check in to the time they leave. They want to feel like it's an important part of their life, because it is. I mean, having surgery and having somebody cut on your nose, face, or body is a big deal, and you have to entrust somebody to do that. So that's a good. I like that analogy, and really Disney did it. I mean, the original Disney, he was magical. He really did it amazingly. Walt Disney was a wizard, even though MGM told him he lacked the imagery, he lacked imagination. Remember that? That was on his desk. It said he lacks imagination when he tried to sell him, Mickey Mouse. Boy, he was wrong. But no, you're right. It is about the experience and how you elevate that, and people want to be treated special, and you want to make sure that you are engaged with them from the beginning to the end. And I think that's really important. And we try and do that in Dallas as well, and I give my patients my private numbers, because if there's anything missing, they call me, and then of course I have to talk about it and deal with it. So, but that's a great thing. I mean, I think so. The experience, the expertise, and really, the outcomes. And I know you do a lot of breast and body contouring. I've seen some of your results. They're fantastic. And then you teach too. You just came back from Colombia, correct?
Yeah, I was down at SAPS. I talked about, subfascial augmentation using internal bra material, and I've done over 1,200 cases now doing that technique. And so I was able to, share. And Dr. Bill Adams was down there, Dr. Unger. It's great to have a panel of surgeons, who just are so good at what they do. And I learned a lot from them too. But yeah, it's great to be able to share with surgeons from around the globe, just, techniques that I've been implementing here.
Wow. So you've done like 1,200 subfascial breast augmentations with internal support. Now, why do you do subfascial and why do you use support? This is in primary breast augs?
Yeah, even in primary. Well, so I started, I was doing dual plane. I trained dual plane, and I still do dual plane, but what I found is, as I was doing this more and more, I usually use the internal bra material initially more so just for support for, problems like bottoming out and capsule problems, all that. And I really loved the results I was getting. And, I think it's super important to look back at our data. So I was looking back at my first 700 cases that I had done with the material, and my revision rates were extremely low. It was like 4% or less. And this is for masto augs. This is all types of augmentation. So, I thought, if I'm using this material and I can lower my revision rates, complications are very low, and to me it's a no-brainer. And so as I started doing subfascial a few years ago, I thought, well, now the next step for me would be, is there a way that I could preserve all the muscle function, preserve as much tissue as possible, and still get a result that's the same as if I did dual plane, right? And so that's what I've been working on the last several years. And I think with, the 6th generation implants that are coming out, especially even things like Motiva and the internal bra, I think we can achieve very predictable, reliable, and beautiful results without having to disrupt muscle and things like that. And I know there's philosophies and out there about, hey, even dual plane, it's preserving, and I get that. But I think this has just worked for me in my practice, and it's been fun to see, the results be consistent that way they are.
Well, that makes a lot of sense. I mean, I've reserved internal bra for the patient that I'm going to do an augpexy on that's got obviously weak lower pole, but you're right, it doesn't make sense. You need to write that up, Jerry. You need to write that up.
I'm working on it right now. Actually, I'm in the process. I presented at ASPS last year, so we're writing it literally right now. So I'm hoping to submit it soon. And I've refused any pay from BD, Galaflex. I'm like, you're not paying me because I don't want this paper to come off bias. So I've taken nothing from them. In fact, I've just paid them money to use their product.
Well, no, that's very honorable of you. And people, obviously as the former editor of PRS, we really need and want and like people like you that are really going to try and, advance the art and share your experience and expertise in an honest, unbiased manner, because that goes a long way. So I love what you said about, doing, finding your own path and really being that's a differentiator and making the experience exceptional. And I really think that really transcends to so many things in plastic surgery and beyond, because, people will mirror that. And what other people will mirror that means, because, flattery, the best form of flattery is somebody trying to mirror what you're doing. Believe me, I've run into that all my life, and I think that's a good thing. And I actually say, wow, that's really a good thing to do, because, you're elevating the standard of care of who and what you are, and you're having fun at it. I mean, those are awesome things. So what are some closing comments for the viewer that they should take home about not only finding their path, but making them a differentiator wherever they are in practice or in life?
Yeah, I think, within our specialty, because as plastic surgeons, I mean, we literally can operate head to toe. There's just so much that we are trained to do and can be very good at, and like I said, you've done hand, you've done breast, body, everything. And now, you're a rhinoplasty expert, face expert. And I think, for a lot of surgeons out there trying to really find that path, I think it's finding something within that framework of something you're passionate about, And so for me, I got really drawn towards breast and body. I mean, I'm in Utah where there's a lot of young moms who need these surgeries, and want them and functionally need them. And so for me, it's become my passion. And then that's really helped drive my practice, I think, and really my education, everything we direct our experience at. And so I think finding for you as that surgeon, what is it that you're passionate about? And I think, because that passion comes through, and I see your passion every day, Dr. Rohrich, and you're posting and showing your results. I mean, it's phenomenal. I can tell you love what you do, and everybody sees that. And I think for surgeons, as we're posting, that's what's going to help you differentiate yourself online, is when people see what you post, they tell right away that you love what you do. Right. And that is a magnet for people. And so I think that's the best way to start, is really to find that.
I agree. Passion breeds excellence, and excellence takes you to another level. And I think that's great. And you exemplify that. So keep it up, and make sure you watch him on Dr. Chiddy. All right. So thank you so much. It's really been a pleasure having you with us. Until next time, stay safe, stay informed, and be the best you can be.
Bye.